Okay, so I wanted to come and talk to you all today about Medicare Flex cards, Medicare spending cards. They go by a couple different names. Regardless of what you call them or what you hear, you're seeing them everywhere. You're hearing about them on TV, you're scrolling through Facebook on your phone, and you're seeing all sorts of different commercials and advertisements for Medicare spending cards, Flex cards, cards that claim to help you pay for things like food, gas, groceries, utilities, rent. They go by a bunch of different names and they seem to be popping up everywhere. So I want to talk to you today about what the heck they are and explain why most people don't qualify for them, and talk a little bit about the misleading marketing tactics and commercials that you are seeing surrounding these Medicare Flex cards. But first, I wanted to let you know who the heck I am. My name is Colin Wattenville. I'm an insurance agency owner based out of Omaha, Nebraska. We are currently licensed in 6 different states at the time of recording and have appointments with about 40 insurance companies representing, I think I counted about 300 Medicare plans, ranging from Advantage plans to drug plans, Medicare supplement plans, of course, we offer. And we also do under 65 health insurance as well for individuals, families, and group plans for small and large businesses. So, Medicare Flex cards, Medicare spending cards, Medicare allowance cards, what are they? They are cards that help people pay for the things that these commercials are claiming. Honestly, they have healthy food allowances. They can help you pay for utilities. There's transportation benefits in there to help you get to and from doctor's appointments. They're fantastic. However, the amount of people that qualify for these plans is very small. I don't know the exact percentage or exact number, but basically to get a Medicare Flex card or a Medicare spending card, you have to be on both Medicare and Medicaid. Now, Medicare, hopefully you know, is the program for those over age 65 primarily. You can be on Medicare if you're not quite 65 yet, but if you have certain illnesses, certain diseases, or you're disabled. So Medicare is the program, generally speaking, for seniors, for those over 65, whereas Medicaid, I want you to see that word aid at the end of Medicaid and think of government assistance. So Medicaid is a state-run program for those who have a lower income, whereas Medicare, you see care at the end, we care for the elderly. It's kind of a way to remember the difference between those two programs. Medicare is the federally funded program for mostly seniors, and then Medicaid is the program for lower income individuals run on a state-by-state level. So there are different requirements for both programs, and obviously not everyone on Medicaid has Medicare, and not everyone on Medicare has Medicaid. So these programs, these advertisements that you're seeing for these flex cards, for these spending accounts, allowances, food cards, whatever they want to call them in the ads, they are for Medicare Advantage plans. So they are for plans that you can only have if you have both Medicare and Medicaid. There are a certain subset of Medicare Advantage plans called dual special needs plans. And so again, these spending cards are out there. They do exist and they're wonderful and amazing for those who do qualify. However, what these ads often fail to tell you is that most people don't qualify for these. These are typically ads run by national call centers, huge corporations with tons of employees who just sit at the phone all day, answering calls for people who call in from seeing the ad on Facebook or seeing the ad on YouTube or on TV when they're watching a program. I mean, they're probably compliant technically. They'll throw in a little phrase saying, call to see if you qualify, or we have flex cards available for people who are on both Medicare and Medicaid, and maybe they'll mention that once. And so they're probably technically compliant, these advertisements, but again, the target market, the people who do qualify for these plans is very, very small. If you do qualify for them, they're fantastic. They help you out a lot. But What the purpose of these ads are for, if you ask me and a lot of other agents, is to kind of spread a little bit of misinformation or pique people's curiosity just enough to get them to call in. And then once they're on the phone with the live rep, with the licensed agent, then the agent's just trying to switch them to any other plan than that they have already. So it's just a lead generation tactic. In my opinion, it's a very misleading lead generation tactic because they're marketing a very niche product very broadly and making it seem like there's federal programs out there that a lot of people qualify for to help them with food and gas and stuff. But again, majority of people are not eligible for these programs. So to recap, Medicare Flex cards, Medicare spending cards, whatever name you want to give them, they are legitimate, they do exist. However, you have to be on both Medicare and Medicaid typically to qualify for them. And it's also not the government giving these cards out. I want to make that very clear as well. These are Medicare Advantage plans that they're advertising, and those plans are run and facilitated by private insurance companies. So the government's not handing out food cards to help people pay for groceries or gas or paying for someone's Ubers or paying their electric bill. These are Medicare Advantage plans. They're called dual special needs plans provided by private insurance companies for a very small subset of people that have both Medicare and Medicaid. And if you enjoy learning about the insurance industry, specifically the health insurance and Medicare world, healthcare news, hearing industry trends, tips, FAQs, information 101 videos. If you like all that stuff, then thanks for being here, and make sure to follow us on your favorite social media platform to stay up to date on more content like this. Thanks for watching.